Looks, love, wealth, health. Let's talk about health. And not only are we going to talk about health, we're going to talk about a disease that is within the 5 leading causes of death in the United States. But there's going to be a twist. Stay tuned. Hey guys, welcome to the Dr. Tess 90210 show. I am so glad that you are here. On this show, we discuss the optimization of your looks, love, wealth, and health. And as mentioned in the preview, today we're going to talk about health. If you're new to the channel, my name is Dr. Tess Washington, board certified physician and surgeon, private practice, Beverly Hills, California. Go ahead, just hit the subscribe button, right? I know you want to. Just go ahead, hit the subscribe button right now. Moving straight on to the topic, let's talk about health. What I would like to discuss is colon cancer. Chadwick Boseman recently died secondary to colon cancer. No, we're not discussing the topic late. Like, wait a minute, how long ago did he die? The reason why I'm bringing it up is because I want to use Chadwick Boseman as an example of being a real hero and how seriously we should look at the disease that led to the early demise of a brilliant young man. Chadwick Boseman died at 43 years old, secondary to colon cancer. From what we all understand, he was diagnosed at 39 years old. 4 years prior, 7 of his best works were made during that 4 years. Let's look at that at a level of detail. When he was diagnosed, the cancer was at stage 3. He probably initiated chemotherapy. He probably underwent many surgical interventions. Not one time did he ever complain, well, not that we know of. And according to his producers, they were not even aware until they heard about his death. There was a patient who I took care of recently, very, very, very close to me, a dear friend. And when we realized that he was ill, he also had colon cancer. It was approximately stage 4. If I tell you what he went through physically, on a daily basis, the pain, the tests, the procedures, it was grueling. The vomiting, the grief associated with the family. It was heart-wrenching to watch. And I can only imagine what Chadwick Boseman went through. He was amazing as far as a hero with regards to being Black Panther. But from my perspective, as a doctor, I feel as if he was more so of a hero because he fought through the discomforts associated with his disease and made sure that he left 7 legacies to the point that we will remember him forever. The other perspective that I would like for you guys to look at with regards to colon cancer is there are multiple areas of the colon where cancer can grow. Sometimes it presents with signs and symptoms, and sometimes it doesn't. With regards to my patient and my friend, his colon cancer was located in the cecum, which is on the right side. A lot of times, colon cancer that grows in the cecum has minimal to no signs because the cecum has the ability to expand. Sometimes you may just get just kind of nauseated, kind of full, maybe just like a little bloating, a little weight loss. Whereas if you have left-sided colon cancer, the cecum is on the right by Mr. Appendix. But if you have left-sided colon cancer, it presents with a few more symptoms, which will lead you to go into the doctor to be like, hey, doc, would you mind checking me out? Like, for example, you may have blood in your stool. And if we look at the large intestine, it basically goes almost in a square. So that means that if the cancer did start in the right lower portion, in the cecum, it can just grow on up the ascending, make a turn, go through the transverse, and then go to the descending. And that's not what we want. What point am I making? For Chadwick to be diagnosed at 39, there's a very good possibility that he may have a family history of colon cancer. If a person has a family history of colon cancer, we want to find out the age the person died in their family who had colon cancer, and if possible, initiate the colonoscopies about 10 years prior. Then there are some other associated cancers which could lead you to have a higher probability of having colon cancer. Colonoscopies, we only request that a patient gets those performed about every 10 years, not unless you have something suspicious growing in, like a polyp or something on that order. And one of the reasons why, they're slow-growing cancers. What am I saying to you? Early detection could save your life. I don't know anything with regards to his family history, his being Chadwick Boseman, or any other test that he had prior. If he knew of a family history, there's a possibility he was getting tested. From the perspective of talking to my followers and my family about health, let's just get a colonoscopy at the appropriate age based on a family history or just based on normal screening. And if you have some symptoms, please don't ignore them. Seek help. They have all kinds of kits that can make it quick, or you get that tube stuck up you and they give you a little pain medicine so you really don't feel anything. So, have you subscribed? Push the button. Go ahead. Just subscribe. All right, guys, I'm not giving medical advice. If you are not my patient, don't jump up from this video and go be like, Dr. Tess said. Speak to your doctor and discuss these issues. All I'm asking is to be aware, maintain appropriate health, healthy diet, sleep, plenty of fluid hydration, exercise, and rest. I look forward to seeing you guys with another topic related to looks, love, wealth, and health. If you like what you heard today, please subscribe, or if you have something to say, leave it in the comment. I read all comments and I try to respond within 24 hours. I'm Dr. Tess, and thank you so much for joining us on the Dr. Tess 90210 show. Take care.